What's up, YouTube and Podcast Nation? Welcome to the From Setbacks to Success YouTube channel and podcast. I'm your host, Quincy Benton. And guess what? I'm a felon. Not only have I served time in federal prison, but I've been divorced, I've declared bankruptcy, I've even experienced a house fire. Some of you too watching right now have gone through some setbacks in your lives as well. Setbacks such as the loss of a loved one. Maybe you have lost your home through some type of natural disaster, or you may have lost a job. Well, I want you to know that there is hope and there's a way to get through. And that's what this channel is all about. So through the interviews, such as the awesome interview that we have scheduled for today with our special guest, and I'll introduce her in just a minute, we will give you tips, strategies, and just overall, just inspirational messages that will help you get back in the game and succeed. If this sounds like content that you would be interested in, please smash that like button and suppress the subscribe button as well. We would love to have you as a part of our community. So with that said, let's jump right into this. We have an awesome guest, and I'm just going to give her just a brief introduction, but I'm going to allow her just to have almost an open platform here, because I know she's going to drop so many great things that we need to know on this channel from a mental health perspective. So important that we deal with the mental health aspects as it relates to traveling through your darkest, deepest, worst times in a case, and giving you the proper strategies to get through that. So first of all, I'm going to introduce our guest. Her name is Dr. Mariechia Palmer. She's a licensed alcohol and drug counselor, licensed professional counselor, licensed marriage and family therapist, and executive director right here in Oklahoma City of Spring Eternal Clinic. What's up, Dr. Palmer? How are you doing today?
Hello. I'm good. Thank you very much for having me. I'm excited.
Yes. So thank you again for being here. And I'm really excited as well about what we're gonna dive into today. So first of all, let's just kind of get the basic stuff out of the way. Tell our watchers and listeners a little bit about who you are, what your background is, and a little bit about Spring Eternal as well.
Okay. Well, as he mentioned, my name is Dr. Mariechia Palmer, and I am the founder and executive director for Spring Eternal. I'm just a little old girl from Spencer, Oklahoma. Ended up graduating from Millwood High School. My family, of course, went through some difficulty growing up as well. There was some addiction involved in our families. And so I always had an interest in, what makes family patterns so different? How can one person be, without an addiction and somebody else has an addiction? So I started studying that. And I went to undergrad and started doing some work in therapeutic foster care. And I'm working with families. And I'm like, how can we help our families overcome some of these addictions and issues that they're having? And as part of that, what I decided was, okay, it's not enough for me to just learn about these. I really want to help people be a part of change. And the best way to do that is to understand how we think. And that's where the mental health piece came in. How we think, how that relates to addiction, and how can we overcome that in our community, and how can we do a better job at talking about mental health and how important that is. And so that's kind of where Spring Eternal derived from. I just wanted to provide an organization where people can be free and open and talk about their mental health needs.
Okay.
Spring comes from setting up people to rise in the next generation. And that's where the acronym came from. So that's what our goal is.
Okay. That's wonderful. That's wonderful. That's well stated, well said. And that's an awesome mission that you have. So you talk about a little bit about addiction, how there's some history of it in your family, and how that it was a kind of motivating to you to start your practice and to embark on the professional journey that you've started on, or that you've taken. But tell me, what types of addiction specifically do you guys address there at your clinic?
We address all types of addiction, because the thing about addiction is it's a brain function. And so main focus is on drugs and alcohol, but there is addiction to all sorts of things. Cigarettes, there's addiction to sex, porn, there's addiction to, some people have addiction to just work. We want to just be busy and be involved and stuff. And I feel like I have a little bit of that in my addiction. Like I always want to succeed. It's like, I got to get another project, I got to do this, got to do that. I can't sit still. So there are certain things that we get addicted to, and it's just a behavior pattern that if you don't get some type of intervention, it can turn into something that is a little bit more detrimental.
Okay, do understand that. Thank you so much. And so, talking about intervention and some of the practices that you use specifically there at your clinic, what some of those be like? What are some of those what are some of those things that you would work with? And could you kind of dive in specifically into some of the if there's just general things, or there are more specific things catered to a specific addiction?
It just depends on the situation. The one thing that we got to understand about addiction is it's just not a standalone issue. Most addiction issues are tied to some type of mental health history or mental health issue. And so just depending on what that connection is, depending on what all is going on with that mental health issue, is going to determine how we provide intervention. Nobody just wakes up one day and says, you know what? And a lot of people have this view, why don't they just stop using drugs? Why don't they just get it together? Nobody wakes up and says,
right,
I think I'm going to just be addicted now, and I'm going to lose my home, lose my family, lose my job, lose my health. Nobody does that. It's just that's not the norm of addiction. Typically, people are trying to mask some pain. So there's some type of hurt that's going on in the family. There are some genes that science is finding that is connected to addiction. But when there's some hurt in the family, some neglect, somebody trying to mask pain, it's just basically what people do to try to self-medicate.
Okay.
So what we do when we treat that is we have to find out what's causing the self-medication. Well, why are people wanting to harm themselves, or what are they trying to run from or escape from? And once we can address that with cognitive behavioral therapy or motivational interviewing, there's a lot of things we can do. Then we can address the entire picture of the mental health along with the substance abuse or addiction issue.
Understood. So I guess to find out the root cause, would that happen through counseling, first of all, to just kind of figure out what, or is it more than just counseling that you would engage in to find that from any of your clients or patients?
It's a process. Okay. So one of the first things that we do an intake. And your intake is just going to find out a little bit about the client, a little bit what's going on. And then you're going to implement some type of assessment. And this assessment is pretty thorough. What's going on in your background? What's your history look like? Who's your parents? Where are your support systems? What does your income and your resources look like? Because if we don't have access to resources, we can't get treatment and be successful in that. So as part of that intake and assessment, then we develop a treatment plan and a treatment process that says, okay, here's the goal. Here's what we're going to work on. What are the best people on the team that can work with this person or family to provide those interventions? And we go from there. And that's with one-on-one counseling or group counseling. Sometimes it requires them to participate in groups with other people. Sometimes it's just that one-on-one conversation.
Okay. Got you. I thank you for that. That clears it up. Now, again, just going back into what I think you were beginning in terms of some of the specific types of treatments that you offer. Can you kind of talk about maybe 3 or 4 of those, and then kind of break those down? What happens in each one of those types of treatments?
And you mean as far as when I said the CBT or the motivational interview?
Absolutely.
Right. Okay, so CBT basically stands for cognitive behavioral therapy. Mm-hmm. And with cognitive behavioral therapy, what you want to do is find out how to change the thought process that precludes certain behaviors. And once you can change that thought process, then you can turn around and maybe change the behavior that comes out of that thought process. So that's what the CBT looks like.
Okay.
Motivational interviewing is just a matter of just trying to find out what's going on with that client, what motivates them to change, what kind of tools can we give them to implement that change in whatever area or part of their life that they're in at that moment. Those are a couple of them.
Okay.
I'm a family systems person because when I went through my doctorate, that's what my degree is. So of course, I'm always thinking about family systems interventions where we can't just disconnect the person from everything around them. We got to look at all different resources and what's going on around them so that we can try to help them to change their behavior. Now, if you take a person and get them cleaned up and then send them right back home to the house where there's a crack house attached to the duplex where they can get their access to the drugs, it does no good. So we have to figure out ways to actually look at the family system, everything that's going on around them as well, in order to implement change.
Understood. That sounds like an awesome uh, uh, process, or awesome levels of treatment and things that you look at with your clients and patients. And I know that sounds like you very much get results from there. So that's kind of one of the things that I want to kind of dive into as well, because as I shared with you before, and as most of our watchers and listeners know, in terms of some of my setbacks, personal setbacks related to incarceration as well as divorce. Those were two of the I guess 4 setbacks that I've encountered, major ones that I've encountered. But I want to kind of dive into some of those things. Do you find that you work with people who have been incarcerated, who have been divorced, and what types of themes do you find that may be common with those types of for people who experience that level of trauma? If that question makes any sense.
Your question makes sense. It's just a multiple question, it's a multiple areas of that question. So when we talk about working with a population of people that's been incarcerated, we have a couple of contracts that we work with in Oklahoma with different agencies to try to provide treatment. And I'll be careful about saying those because I just don't know what what we can and cannot say as far as that kind of stuff is going on. But we do have a couple of contracts with the state of Oklahoma where we provide intervention for people that are either facing going back to prison or trying to stay out of prison. And so they have to get treatment in order to be a part of that, just freedom, to be able to keep their freedom.
Okay.
So we have juveniles that we work with Oklahoma, and then we have adult clients that we work with as well to provide intervention services. So we do have that. Now, as far as divorce, what we're talking about with divorce is usually a process of grief. A lot of times when you're going through a divorce, it can be like experiencing a death. It just depends on what's happening. Your life completely changes, what your expectations were, what your goals were, the vision that you had for your family and your children. And when that gets cut short for whatever reason, whether it's by your own accord or by someone else's actions or a combination of the two, that hurts. And that's a grief process that people have to go through. So we also provide interventions for that. We have tons and tons of workbooks, worksheets where we can work with people through that process to help them to be able to get on a better path. A lot of people are depressed when they're divorced.
Right.
And so it's hard to kind of, get up and get moving and get motivated. And one of the biggest things that I've seen when people go through divorce is that the struggle to connect again and have more positive relationships going forward, because people get hurt and there's fear, or there's just, I just don't want to do it because I don't want to go through that again. So just a process.
Just a process. Okay. And I appreciate that those, I think that really, kind of really addresses some of the things that I think our again, viewers would want to hear related to those things. So a couple of more questions. Just in terms of going back to your practice, I know that you're based right here in Oklahoma City, and but it does appear that you not only can service clients in Oklahoma City, you have the ability to service clients throughout the country. Is that the case on some level?
Yes. So we are based in Northeast Oklahoma City as far as our office is concerned. The great thing that came about after COVID was that now we have telehealth services. So we've had to jump in and develop our HIPAA compliant software and our procedures to get, be able to provide services through Zoom. And we can provide therapy to anyone in the state of Oklahoma with certain insurance panels. And then we have therapists in probably about 8 or 9 other states. And sometimes I can't keep up with it, but I know Texas, Florida, California, Wisconsin, Virginia. There are several states where we do telehealth services. Okay. Those particular services are just cash only because we're not licensed on insurance in those particular areas. But in the state of Oklahoma, we're on every major insurance panel.
Okay.
All of that. So.
Got you. So that does help to address. Now, let me ask, because I know some of our watchers and listeners you didn't mention the state of Georgia. Would Georgia happen to be one of
Atlanta is one of the places.
Okay.
Yes.
Okay. As well. So that's awesome to hear that. So again, we will provide our viewers and viewers and listeners with your contact information, and I want you to share some of your contact information a little bit later in this episode, so that they can reach out to you if they're interested in getting those services. So thank you so much for that as well. Let me, I got a couple more questions for you, and then I want to wrap things up, and I do appreciate your time.
No problem. Can I just say something real quick?
Yes.
So we've talked a little bit about like the clinical piece of therapy and, the cognitive behavioral therapy and the interventions and who we serve and why we serve. But I want to try to take some of the negative stigma out of therapy. Some people feel like therapy is scary. Right. It's like, I'm going to sit on the couch. You're going to ask me all these questions. We do ask a lot of questions, but therapy is just an intellectual conversation. It's a conversation between two people. I've had conversations with people where it's just like talking to someone but from a professional standpoint that can give you professional advice. It's not all clinical. I don't say during a session, today we're going to use CBT. That's not the way it works. I don't say, today I'm going to give you a motivational interview. It's, hey, tell me what's going on today. What are your thoughts? When people are talking about divorce, well, let's talk about how that happened. Why do you think you ended up in that place? What can you do differently next time? We look at the overall picture and it's basic conversation. It's not the clinical terms during therapy sessions.
Got you. So that's important to understand as well. So they don't have to, again, there's a lot of, there's just a lot of things attached to having to seek professional help when it comes to mental services and our mental health. And I think it does appear that we are in a phase where we're seeing some of that that actually come down. I mean, it doesn't seem to be, all the things associated with that it used to be. And this just seems, it's getting to the point where it's just part of good maintenance. It's just part of good maintenance as far as keeping yourself, just as you go to work out at the gym, or, you go to, to see your doctor to check your blood pressure and cholesterol levels and everything else. I mean, you need to, a part of your checklist of things that you need to kind of make sure that you're together on would be, in terms of your mental health and making sure you're in a good place with that as well. And that to me, so many times, and I'll kind of share with you my story. There were times specifically that I remember where, one, I felt like I needed help, and I was in a place where, I had good family and good supportive people around me, but I didn't feel like they really truly knew what I was going through. One of those times I would say it was after I had experienced a house fire. I truly didn't feel like, any people really truly understood what I was going through emotionally related to that. There was a lot of emotional stuff that when you lose everything that, I don't know that everybody is really can really truly relate to that. I did find through conversations that I had people that I ultimately ended up meeting who helped serve me on that level. But again, I think I could have cut a lot of the time that it took me to resolve those issues by seeking professional help. The other instance was during my first marriage. And I remember specifically, my wife at that time offering that we seek counseling, professional counseling to try keep our marriage together. And I just refused. I just felt like, I'm not about to pay nobody to try and, fix me. I'm good. And I just didn't see the point in it. And in hindsight, I would have done things I would have done things differently, knowing what I know now, and the importance of mental health. So I just kind of want to dive into that a little bit. And again, I do appreciate what you're saying and what you're offering, in terms of don't feel like don't feel like you this is something that to be embarrassed by or ashamed of. If you feel like you're out here and you got thoughts going through your head and the things, your brain is not producing the outcomes that you want, that you hope to have in life. You need to seek help.
Absolutely. I think that the great thing about it is that we're starting to talk about it more. So that stigma is decreasing, and that's a good thing. It's interesting to hear you say that you first told your wife, no, I'm not going to do it, because that's African-American males is the hardest population as far as having concerns about treatment that I've noticed in my practice. I can't overgeneralize, but what we've noticed. But what we do know is that if we can just get people that one session, just get them in the door, just get them on the video, and they can see that it's not what they think it is, a lot of times those walls come down.
Gotcha.
And that's just the hardest part, is just getting them to see. It's just like anything else. I have a therapist when I go through something that I have to reach out to, and I say, hey, it's time for me to come back in. I'm kind of dealing with some stuff that's getting heavy. My father was murdered last November. That was tough. In the middle of a pandemic, he gets murdered. I got all these family issues. I needed somebody to talk to and process that with. Everybody expects you, especially as a therapist, to be the strong person.
Right.
But the advantage that I have is I have an office full of therapists. We can kind of talk about ideas, and they're like, yeah, you need to go and talk to your therapist.
Absolutely.
I do that too. So I think we got to be able to look at it, like you said, just like we look at our checkups, our doctor's appointments. There's so much stuff that can happen that make you susceptible to physical sickness, because we don't take care of what's going on in our bodies, in our minds. And so we get stressed out, and then it causes us to get all other kind of things.
That's right. Another question, and this is, I actually saw this on a recent board I was on online, and it had to deal with the confidentiality of the kind of your relationship with your clients and patients. How does that work? Is it similar to like the attorney-client privileges, in the sense that if there are just certain things that people are really, they have things going through their heads, and they have things that they may, how much legally are they protected when they, divulge those things in your sessions?
Right. So clients are protected unless they threaten to harm themselves or someone else. Other than that, they're completely protected by HIPAA. There are some exceptions, like court orders. If somebody's on a murder trial or something like that, and we get subpoenaed or court ordered, we'd have to respond to that legally. But if somebody is telling us that, things are going on with them, frustration on their job, with COVID, so many people are frustrated about having to go back to work and different things like that. Those things are confidential. We don't tell anybody that information. Those files are kept confidential. And that's why I mentioned earlier about a HIPAA compliant platform, because it is protected so that your information doesn't get out. That's the other reason why I didn't want to mention who I have contracts with, just because I'm always really careful about the potential of, getting somebody's information out there. But yeah, it's completely protected.
Understood.
Now I had an incident where I was seeing a couple,
mm-hmm.
and I saw something, that I can pop up on your suggested feeds on social media from somebody. So, because our phones are anyway, I saw that, and I had a spouse that inboxed me with some information that was inappropriate. I just had to cut the relationship off. I can't tell the other spouse what happened.
Right. The conversation or the topic sometimes comes up that from conversations that I have, is in terms of people not maybe wanting to get these services, mental health services, is that they can't afford it. Mm-hmm. What are some options for people if they're uninsured or, just low on funds? What are can they still get treatment through at Spring Eternal?
I'm so glad you asked that question, because that is very important. Although we take EAP from a lot of big companies and we take all the major insurance, we also take Sooner Care. A lot of people have Sooner Care, and they don't know that your Sooner Care will pay for your mental health treatment. And the great thing about Spring Eternal that we've done is we wrote a nonprofit. About a year after we started business, we decided we needed a nonprofit so that we can raise funds, because we didn't want to turn anybody away that needed treatment. So we raise those funds, and we pull from that. When somebody calls and they need an appointment and they don't have insurance or they don't have an ability to pay, we can use those funds from our fundraising events to be able to provide those services. So we're not turning anybody away that needs assistance.
That's awesome. And I hope everybody who, here locally specifically, here in the Oklahoma City metro area, will take that into consideration, that there are funds available to you if you're, just short on cash or uninsured. there are no excuses, basically, no excuses to not get the services that you might be needing related to your mental health. So definitely reach out to them, let them know what your particular situation is, and they can assist.
Yes. And let me throw in too that even though people have insurance, sometimes their co-insurance or co-payment is too high or deductibles.
Right.
That's another reason why we have that fundraiser so that we can meet that need as well.
That need.
So,
that's awesome.
So you just have to protect everybody. You can't share that information. It's completely confidential. You just have to go on.
Okay. And one more thing inside that, you did mention that the two exceptions would be in the event. It sounded like what heard you saying was in the event that you may have suicidal thoughts or homicidal thoughts.
Correct.
Dive into that a little bit. What then are you required to do in either case?
We're required either to notify the authority or notify the next of kin. So, if somebody's threatening to harm themselves or has a plan to carry out suicide, then we have to notify their emergency contact, inform them that they have this plan and what that plan is, and then document that we've given them a plan to intervene with that. Here's some resources. They may need to go to the emergency room. Here's some inpatient facilities. And sometimes we even help facilitate that by contacting them ourselves, seeing if they have a bed available, and so forth. With homicide, we have to contact the authorities so that they can contact that family that the homicide may be towards. So
okay.
With that.
And that was that's another pod or show topic that I've actually have on the board, because I do want to, I know that there are people who, when they get in these type of pinches, or in life, one of the things that, I talk about is my bankruptcy. I know how that what that does to you when you go through a bankruptcy, can do to you, I should say, rather. And so, the discussions around suicidal and homicidal thoughts, I'm like, well, who do you go to? If you're having these types of thoughts and you really need to figure out, how do I not cross this line? Either way, how do I not cross this line? And that was one of the conversations that I felt like it would be useful because you do want to feel like I would, when you're in that place or space, you want to feel like you can have a place where you can share things and be safe, in the sense that you're not, I just need help in a sense you're saying, I just need help working through this issue or these things, these thoughts that I'm having, and so that I can get beyond it and not cross the line. What would you recommend for someone if they couldn't go to you? Where could they go, or is there anywhere they can go?
Well, I want to clarify, there's a difference between having suicidal thoughts and a plan for suicide. A lot of people will go through times where they're like, it would just be easier if I just didn't have to go through this pain. It'd be easier if I was dead.
Right.
But I'm not going to do it because I have to take care of my kids, or I have to do this, or, I'm not going to do that. So having a thought and needing a safe place to process through that thought, identifying where those emotions are coming from and how we can help them to get to a better mind space as far as the way they're thinking is something that therapists can do. You can contact any therapist or provider. Some people reach out to their church or ministers. There's a lot of different areas that people can reach out for. The difference comes into place when somebody says, well, what I've decided I'm going to do when I get home tonight, I'm going to take a whole bottle of pills, or I'm going to get a shotgun and I'm going to blow my head off.
Gotcha.
That's a different type of intervention.
Okay. And for homicidal thoughts, would then be the case?
Yeah, people get mad and say, I just want to hurt them. I just want to go over there and, take everybody out because they're angry. As a clinician, and once you get experience, you have an idea of when somebody's angry versus when they have a plan. The whole difference there is the plan or the threat. When somebody has a plan or a threat versus they're just having angry outbursts, the way that we intervene in that is just a little different.
Gotcha. Thank you so much. I appreciate that. And I appreciate you. I think there was some real gems being dropped here. I know that, everybody who's tuned in so far, they're going to get some good information that they can take and use and know, what it is that this process is about, so that they will have a better idea of how to move forward in making sure that their mental health is in the right place. So let's just go from here. Tell us if anybody who's watching and listening, how they would be able to contact you and contact your clinic for services.
Okay. Our actual website is www.springeternal.net. And so it's just springeternal.net. And they can find out more information about us, how to contact us. Our local number is just 405-601-4565. And then we have our social media accounts, which is Instagram and Facebook. And both of those are Spring Eternal Helps. Now, I get inboxes probably at least once a day from people saying, I heard you're a therapist. How can I get help? So we're always answering those and trying to get people to get the services that they need.
That's wonderful. That's wonderful. All right, guys and gals, you heard it here first. This is what we do here on this platform, From Setbacks to Success. Again, as always, I'm glad that you joined us and you tuned in and stayed locked in. Also, as always, I hope that you gained value from today's episode, which I'm sure that you did. Please feel free if you have issues that you're going through that you want to address, reach out to Dr. Mariechia Palmer. Her and her team there, they're going to do a phenomenal job to assist you with those. So make sure, again, that you contact her through the various methods that she's given to reach out to her. Also, if you have ideas in terms of a podcast or something that you're wanting to start yourself, we're right here in Oklahoma City at Blacken Studios. Big shout out to our producer, Buck. Buck, you still there?
Of course.
All right. Appreciate you, Buck. Thank you for the awesome job that you always do, professional job that you do here at Blacken Studios here. So again, you can reach out and them directly at their website at www.blackenstudios.com, or you can email him directly at podcast@blackenstudios.com. That's podcast with an S at blackenstudios.com. Again, you can reach out to us directly, From Setbacks, 2 success.com on our website. And again, we appreciate having you today. And as always, don't let your setbacks stop you from your success. And we look forward to seeing you back out here doing your thing out here, healthy and whole.